Clinicians are healthcare professionals who are directly involved in patient care and treatment. They are typically licensed to diagnose and treat medical conditions and may work in various healthcare settings such as hospitals, clinics, and private practices. The term clinician generally includes 1. Physicians, medical doctors, MDs, and doctors of osteopathy, DOs, who diagnose and treat illnesses. 2. Nurses, registered nurses, RNs, and nurse practitioners, NPs, who provide care, education, and support to patients. 3. Physician assistants, PAs, professionals who can diagnose and treat conditions under the supervision of a physician. 4. Other allied health professionals. This can include physical therapists, occupational therapists, and pharmacists, among others, who provide direct patient care. As for medical assistants, they play a supportive role in healthcare settings by performing administrative and clinical tasks, such as taking patient histories, scheduling appointments, and assisting with examinations. However, medical assistants are generally not considered clinicians because they do not have the authority to diagnose or treat medical conditions independently. Instead, they work under the supervision of licensed clinicians, helping to facilitate patient care. Osteopathy is a branch of medicine that emphasizes a holistic approach to healthcare, focusing on the interrelationship between the body's structure and function. It was founded in the late 19th century by Dr. Andrew Taylor Still, who believed that many health issues could be treated by manipulating the musculoskeletal system. Key principles of osteopathy include 1. Holistic care. Osteopathy considers the whole person, including physical, emotional, and environmental factors, rather than just treating specific symptoms. 2. Musculoskeletal focus. Osteopathic practitioners believe that the body's structure, musculoskeletal system, plays a critical role in its overall health. They use hands-on techniques to assess and treat issues related to muscles, bones, and joints. 3. Osteopathic manipulative treatment, OMT. Osteopathic physicians are trained in various manual techniques to diagnose and treat conditions. OMT involves using the hands to move a patient's muscles and joints to promote healing and improve function. 4. Preventive care. Osteopathy places a strong emphasis on preventive care and wellness, encouraging patients to adopt healthy lifestyles and make informed decisions about their health. Osteopathic physicians, DOs, are fully licensed medical doctors who can prescribe medication, perform surgery, and practice in all medical specialties similar to allopathic physicians, MDs. In many countries, they are recognized as equivalent to MDs and undergo similar training, including completing medical school and residency programs. Overall, osteopathy offers a distinctive approach to healthcare that integrates traditional medical practices with a focus on the body's musculoskeletal system and its impact on overall health. MDs, doctors of medicine, and DOs, doctors of osteopathy, are both fully licensed physicians, but they differ in their training, philosophy, and approach to patient care. Here's a breakdown of the differences, educational requirements, and status. Differences between MDs and DOs. 1. Philosophy. MDs practice allopathic medicine, which focuses on diagnosing and treating diseases primarily through medication and surgery. DOs practice osteopathic medicine, which emphasizes a holistic approach, considering the body as an integrated whole and focusing on the musculoskeletal system's role in health. DOs are trained in osteopathic manipulative treatment, OMT. 2. Training. MDs typically attend allopathic medical schools, where they receive training in a standard medical curriculum, including pharmacology, surgery, and clinical practice. DOs attend osteopathic medical schools, where they receive similar training, but with additional coursework in osteopathic principles and manipulative techniques. 3. Residency. Both MDs and DOs complete residency training in their chosen specialty, which can range from 3 to 7 years depending on the field. Length of schooling. Both MDs and DOs generally follow a similar educational path. 1. Undergraduate degree, 4 years, typically in a science-related field. 2. Medical school, 4 years, MD or DO program. 3. Residency, 3 to 7 years depending on specialty. In total, both MDs and DOs typically complete 11 to 15 years of education and training after high school. Status and recognition. In terms of licensing and practice, both MDs and DOs are recognized as equivalent physicians in the United States and many other countries. They are both authorized to prescribe medications, perform surgeries, and practice in all medical specialties. There is no inherent difference in status between MDs and DOs. Both are respected within the medical community. However, MDs are more numerous and may be more familiar to the general public, as allopathic medicine has been the traditional model of medical education for longer. Ultimately, both MDs and DOs are highly trained medical professionals, and the choice between them often comes down to individual preference regarding their approach to healthcare.